When Elijah was born, we had no idea that he had biliary atresia. There was no other way to fix his liver other than to be given a new one. And unfortunately, he was so small that there isn't a lot of livers out there that would have fit him. We had to have quite a serious conversation about what was involved with the surgery, but I could kind of tell that the surgeons and doctors were quite excited because essentially Elijah would be the first paediatric patient in the UK to use the HOPE machine.
One of the major challenges in pediatric liver transplantation is the scarcity of donors. The true gold standard donors are becoming increasingly rare. Our patients are getting sicker because the waiting times are also getting longer. Rather than taking the liver out of a donor and putting it on simple ice, we connect them to this VitaSmart liver perfusion machine, which is a pump, and basically oxygenated solution gets circulated inside the organ and provides the liver with some oxygen. This restores the liver cells' energy and reduces the injury. Knowing that the livers are going to be optimized during that time allows us to confidently use them in very unwell patients.
So before Harry's third transplant, Harry was really poorly. We'd had 3 bouts of sepsis, which had landed us in hospital with some fairly, serious antibiotics. Because he'd had transplants before, there was a lot of scar tissue. And the way the second transplant had grown meant that it took a very long time to remove before the new one could go in. And the HOPE machine was absolutely vital in keeping that liver as healthy as it could be.
And it meant that they didn't have to panic, they didn't need to rush, because they knew that that liver, which they described as beautiful, was being very well cared for by the HOPE machine, which meant they could take their time.
I've been through the process 3 times now, and it was only on the 3rd time that we had the HOPE machine. And I think it's really changed the game for liver transplants, and I hope it really helps people in the future.
For us, it's been a game changer. We feel more confident accepting certain organs. That gives patients in need of a liver better chances of getting an organ.
But it kind of just allowed me to think of Elijah's future now, because that's what it's given us essentially. It could have just been we had him for a few months and he was gone because there was nothing else that we could do. But now he's 2 years old and he's a fighter.